Welcome, Dr. Shah. There was a recent Harris poll that revealed some interesting insights about people's understandings of heart disease. Tell us about the results.
I'll be glad to. So the Harris poll results actually shed some very interesting light into what we know about heart disease. For example, there is an increasing awareness in terms of how to prevent heart disease, which is good to know. There's also an increasing awareness as to how do we detect heart disease, what sort of testing can be done. But what really surprised me the most was the fact that we still have a lack of education when it comes to the treatment choices. What can we do for our patients who have heart disease? What sort of treatments we can offer? And that's where we need to do a better job at educating our folks.
This does sound like some interesting information. What is it that we really need to be aware of?
I, I think that one of the most important point would probably be the fact that timely detection can prevent a heart attack. Because once if somebody has had a heart attack, yes, life can go on and we can continue to help them with medications, but that part of the heart is damaged. We need to do everything in our power, not just as physicians, but even as community, to be aware of our risk factors, to seek out proper medical evaluation from your physicians, knowing whether do you have history of smoking, is there any family history of heart disease, and then going from there. I think if you can detect heart disease on time, in today's world, we can fix it really well.
So when we're trying to detect heart disease, are there particular people that need to know this information even more? What are some of the risk signs?
So I'll tell you some of the common risk factors. Anybody obviously with family history of heart disease ought to be aware and get themselves checked out. Somebody with history of hypertension, diabetes, high cholesterol, smoking history, poor dietary habits, lack of exercise, excess weight. As we age, our risk increases. So all of these are risk factors and everything adds on. So kind of understand what are your risk factors, talk to your physicians, and the physician will guide the person as to what is the best way to detect if the person already has heart disease or not. The commonest form of heart disease is called coronary artery disease, where there is cholesterol blockage built up in one of these arteries. These arteries, when they narrow, they restrict oxygen and blood flow to the heart muscles. That will lead to some symptoms, whether it's chest pain, shortness of breath, feeling tired or fatigue. This can be warning signs, so you got to be aware of those and talk to your doctor and get yourself checked out for those things.
Talking to your doctor, yes, is key. Is there a difference between men and women when it comes to heart disease?
Well, there are some subtle differences. There has been a lack of awareness, so to speak, as well as lack of science when it comes to heart disease in women. We have learned very important points in the last several years. More women die from heart disease than men do. More women die from heart disease than they die from breast cancer. These are very, very important points. Now, heart disease does affect women probably a little bit later in their life, but the risk factors remain the same. So even a woman with family history or prior smoking history or history of diabetes run the same risk as a man in terms of heart disease. One of the interesting points are the symptoms. A lot of women either have no symptoms or maybe they don't like to talk about it. So fatigue, feeling out of breath, feeling tired, sometimes even heartburns. So women tend to have a little bit more atypical symptoms. I think that's why it's so important to be aware and get yourself checked out.
So what should we do to help protect ourselves from heart disease?
Look, I think it is multiple factors we need to account for. So first of all, we ought to be aware, make some good choices and live a heart healthy life, whether it is weight loss and daily exercise, maybe daily aerobic exercise, 20-30 minutes a day. That would be important. There are certain medications. If you have diabetes, you've got to treat it aggressively. Cholesterol ought to be treated aggressively. But what is really remarkable is that if there is somebody with coronary artery disease or heart disease, we live in the world today where we have these stent technologies. For example, there's this stent called Synergy. Synergy stent is one of these newest technological advances which really allows us to put it in, open up the blockage and heal the artery for a long time.
So it does seem like there's always these new inventions or new findings to help people deal with heart disease and live a healthier life. Where can my viewers find more information?
Sure. So Synergy stent especially, which is one of the newest breakthrough, is a very interesting stent. It is a stent which has a drug coating, so it prevents the artery from re-narrowing. It has a bioabsorbable polymer which allows for the blood vessel to heal. It is very ultra thin, so it can be delivered to whichever part of the coronary artery we want to. So it really does a fantastic job, not only short term but also long term in preventing recurrence as well as preventing heart disease. I encourage our folks to talk to their physicians. I think that ought to be the primary source of their information. But one of those websites which can be very helpful is given by Boston Scientific, the company I'm partnering today to deliver this message. But the website is bostonscientific.com/synergy patient. If our folks can go to that website, they can really learn a lot of valuable things we discussed today.
Excellent. Thank you so much for sharing this very important information with us. I'm going to get this site out to my readers so they can all learn more about heart disease and how to live a heart-healthy life. Thank you, Dr. Shah.
And thank you for having me.